Good afternoon, Senator Tillis. My name is Tracy Pastor. I am a licensed professional registered nurse in the state of North Carolina. I am also one of your constituents. I would like to take a few minutes of your time today to discuss a very important bill that was just reintroduced at the General Assembly of the Senate on January 25th, 2023. This is the Compassionate Care Act, Senate Bill 3. This vital bill would legalize medical cannabis for many North Carolina residents who suffer from debilitating medical conditions under the direct supervision of their personal trained, licensed physician. I have been a registered nurse for 25 years, having worked 18 of those years in the intensive care unit. I currently work in the post-anesthesia care unit. I am also a student at the University of North Carolina, Wilmington, in the master's program for nursing education. Severe illness, pain, suffering, and high anxiety are often symptoms that I do see in my nursing practice. These conditions are often treated with very dangerous substances such as opioids and benzodiazepines. It is these substances that have contributed globally to drug misuse, abuse, and many tragic deaths. It has left many children without parents and many parents to bury their children. Research has proven that cannabis is a much safer substance than an opioid, since it is nearly impossible to overdose and it is significantly less addictive. The Compassionate Care Act, Senate Bill 3, would require the State Department of Health and Human Services to issue identification cards to anyone that would qualify to be prescribed medical cannabis by a licensed physician. It would set standards for doctors to issue prescriptions. There are many safeguards in place with this bill. The main identifying requirement to qualify for medical cannabis is a debilitating condition such as cancer, seizure disorders, Parkinson's disease, Crohn's disease, AIDS, multiple sclerosis, ALS, and post-traumatic stress disorder. This bill had great momentum and bipartisan support last session and passed Senate 36-7, but it never made it out of the House Rules Committee. It is imperative that this bill be pushed through and passed to ensure that North Carolinians with debilitating illnesses can receive the treatments that they deserve. Many medications to treat severe debilitating illnesses are highly sedating. According to studies conducted at Harvard, patients claim that cannabis allows them to resume their previous activities without feeling too sedate and disengaged from the world. Of special consideration is the thousands of U.S. veterans who suffer from post-traumatic stress disorder and severe anxiety directly related to their duties performed to protect this country. According to the U.S. Department of Veteran Affairs, 2 out of 10 veterans with PTSD also have a substance abuse disorder. Veterans are 1.5 times more likely to die by suicide due to this. Medical cannabis is a proven safe therapy for PTSD in veterans. 34 states in the United States allow medical cannabis. 83% of U.S. veterans support medical cannabis programs. The North Carolina Medical Society has supported the development of research regarding medical cannabis. Medical cannabis should be a legal choice between a patient and their own personal physician. As a healthcare professional, I understand the hesitation regarding cannabis, especially in terms of recreational use, which can lead to misuse and abuse, especially with those of underage. I am also a mother of 5 and do have concerns about cannabis in our children today. The use of any substance and medication does not come without risk and side effects. Cannabis does alter judgment, thinking, and does cause impairment. Cannabis is widely available, especially today with the legislation of recreational use in surrounding states. The first step for North Carolina to make cannabis use safe is to pharmaceutically legalize its use as a medical treatment. Senator Tillis, are you in support of this bill, the Compassionate Care Act, Senate Bill 3? Will you vote in support of this bill to North Carolina residents who are in need of this treatment? As a healthcare professional, I back this bill 100%. I look forward to your views and support on this important bill. Severely debilitated North Carolina residents deserve compassionate care. I thank you for your time. Thank you.